Okay, at just about 3:30 on the dot, calling to order Board of Health meeting for Tuesday, February 11th, 2020. My name is Ty Menser. I am the chair of the Board of Health for 2020. To my left,
Gary Edwards.
No, John Hutchings.
we have Lydia Hodgkinson, the clerk of the Board of Health, and we have our director of public health, Shelley Slaughter, and our county manager, Mira Chavez, and a lot of public health folks joining us here in the gallery. Called the meeting to order. We need an approval of today's agenda.
Mr. Chair, I move to approve today's agenda.
Second.
All in favor?
Aye.
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 Agenda approved. We need approval of meeting minutes from January 14th regular meeting and our January 28th special meeting.
Mr. Chair, I move to approve the meeting minutes from January 14, 2020, the regular meeting, and January 28, 2020, special meeting.
Second.
Any further discussion on that item? All in favor?
Aye.
Aye. Motion carries, and we have approval of meeting minutes. That takes us to item number 2, which is proclamations, and we have 2 today. The first being Children's Dental Health Month. We are joined by Mary Ann O'Garo, Karen Lewis, and Caroline Sedano. You're welcome to join at the podium with Mary Ann, if you would.
Thank you.
And I'll turn it over to Mary Ann.
Okay. Again, my name is Mary Ann O'Garo, and I'm the supervisor of the Public Health and Social Services Oral Health Program, and I'm very pleased to see that you all are considering proclaiming February Children's Dental Health Month. And in the spirit of that, we have 2 community partners here going to share a little bit of information, but before they do, I just wanted to share a little bit about this particular observance. Children's dental health was first observed in 1941. We've been looking at this issue for a long time. But in terms of raising awareness about the importance of dental health, what I would say to you is that in Thurston County today, it remains incredibly important for both quality of life and overall health for both adults and children in Thurston County. From the public health and social services perspective, one of the really important components of addressing oral health is that it actually promotes health equity. And when we say that, in Thurston County, what the data shows us is that we see some real disparities or some real differences in health based on both age and income. So age in particular, we see more pain, less access to care, both among children and adults 60 plus. So that's concerning, and that's something that we're really interested in addressing. The guests today that we have with us are going to share a little bit more about some work that we do collaboratively through the Thurston Oral Health Network. The network was formed in 2018, and in fact, last year we were here at the very beginning start of that network work together. The network is made up of 6 partners in total. And the public health and social services role in the network is to offer support to provide 2 particular types of evidence-based strategies in Thurston County, and that is to provide community education, which in the back of the gallery here, Leslie Price, who is our oral health coordinator, supports, and then also to bring preventive dental care to children, which looks like school-based dental sealant clinics. And with that, to make sure we stay on time, I'm going to have Carolyn go first and share a little bit more about the work that she does with the network so that you can hear that.
Thanks, Mary Ann, and thank you all for having us today.
Can you bring the microphone up?
Oh, sure.
Sorry.
My name is Caroline Sedano. I manage the oral health program at Choice Regional Health Network. So we've been working with the health department as well as the Arcora Foundation to really get this network up and running. And so we're entering our 2nd year of growing a network. And what does that mean for me? It means getting people excited about oral health. It means getting people to take on projects that can really move the needle on accessing oral health for their own community. And we've made a lot of really good progress in getting more people to accessing dental services and getting into dental care, but there are still so many barriers that people experience in getting into the dentist, especially for people that are high needs. And one of our goals is to really work with people so that they the first time they're accessing dental care isn't when they're in extreme pain, but it's before they reach that point. So we're working with the dental community to reduce some of the stigma they have around accepting certain clients. So making sure that there's, better services for clients that might not have been to the dentist in a long time, working with dentists and their hygienists on how to be more accepting of all people that are accessing dental care. As Marianne said, really trying to make sure everyone has equal opportunity getting in to see the dentist. And then on the other hand, we're also working with those same families who may not have been to the dentist in many years, or maybe they can't afford to buy toothbrushes, so they have a lot of anxiety going in to see the dentist. So working with families on, getting to their appointments on time and making sure they actually get in the door. We're also working with community partners to find other places where people can access dental care. So as Marianne mentioned, working with schools to get dental services in schools, working on getting mobile services available in the community, and working with just finding other opportunities to access dental care to reduce those barriers that people experience. So through this networked approach, we're really trying to target many different avenues for people getting care and trying to reduce those many different barriers that people experience. And for us, we hear so many stories about how people's quality of life just really improves when they get out of pain. People's quality of life really improves when they reduce that anxiety. So it really is about improving people's quality of life and being able to go to work and take care of their kids. So thank you.
Good afternoon. I'm Karen Lewis, a Senior Program Officer with the Arcora Foundation. And Arcora Foundation is the foundation of Delta Dental of Washington. Our vision is oral health equity for all people in Washington, including Thurston County, with special emphasis on those who face the most barriers and experience the most high risk in accessing services and programs that could improve their life and their health. As the primary funding partner of the Thurston Oral Health Network, we're committed to investing in this, in people and approaches that have the greatest chance of sustaining over time. And we have some amazing partners on board that are already making a great impact in this county by increasing access to dental care for uninsured adults and children and seniors, integrating oral health services into well child visits, medical visits. So training medical providers to actually bring the mouth back into the body during the well child visit, educating the public on the importance of oral health to overall health and chronic disease management, and then promoting a new free online tool that our Arcora Foundation has developed to link people needing dental services to providers in their area who actually take their type of insurance. And this is primarily being used by the Medicaid population with their Apple Health insurance. So I just want to thank you for your support and the proclamation for Dental Health Month and for all the great work that's happening in Thurston County.
Thank you, Karen. Any questions for our guests?
Well, I guess I'd just like to echo support for all you folks do, and the other folks at the health department have heard me say this quite a bit, but kids are 30% of our population, but 100% of our future. And that really makes it so crucial that we get this aspect of their health care taken care of, because it does affect everything else. So thank you for what you do.
I like what you said about bringing the mouth back into the medical, that annual medical thing. My wife was an RDA, registered dental assistant, for decades ago, and she was always on us, me and the kids, about brush, floss, brush. I mean, she was on it. And so it's vitally important. And our kids, still, my grown kids have beautiful teeth, and our grandkids have beautiful teeth. Love it. So I hope people watching take it seriously. Get your kids taken care of. It impacts so many other functions of the body and health.
Caroline, I had a question for you. Some data that Marianne has presented at Thurston Thrives about disparities in health outcomes there's some pretty alarming stuff with rural communities versus urban communities, and Thurston County being as it is, we have both in a sense. So you mentioned something about mobile services. Is there such a thing as a dental truck that rolls through to Nino or somewhere like that, Rainier, and provides dental? I've never seen such a thing. I know we have Bloodmobile and we have other things like that. We have mobile shower units that go to homeless camps. I mean, seems like a pretty cool idea to be able to provide to rural communities?
Yeah, so it's actually thanks to the Arcora Foundation, the Smile Mobile.
Smile Mobile, there
It's
you
a
go.
statewide, there's only one, and
Okay.
it covers the entire state. But because of the work we're doing, it does come to Thurston County fairly often. I think just this month it was in Yelm, and it's been in Olympia, it's in Thurston. It comes to various, it works, it's usually connected with some sort of medical clinic. So Olympia OBGYN, it parks in their parking lot and they can just refer directly into it. It's often connects with schools so that kids can just go right into the clinic. So yeah, we're working on getting that out to more places. But the Olympia Free Clinic, which is located downtown, as you all probably know, is working on trying to figure out ways to provide dental services for some of their clients. Maybe not mobile, but in using different locations around the community to host a dental clinic or dental services being offered. So mobile in kind of a different way, it might just be roving, might be a better word, but sort of different ways of providing dental services maybe in non-dental spaces.
Great, that's cool. I thought I asked that.
I'm glad you asked that too. Are you hooked up with do they hook up with the schools at all?
Yeah, so I'd have to, I don't know if Karen might know more about how they actually find the locations, but I think out in Yelm, they were working with the Yelm School District, I think, to kind of coordinate, make sure the schools know when they're going to be there. Sometimes I think they might, be out in a parking lot where there is a high number of people that might utilize the services.
Beautiful.
But like I said, that's only one van that's for the whole state. So it's really hard to, cover all the need. So there's lots more need that's out there. And so finding other opportunities outside of that one space. So getting them into, when a kid is going to see their pediatrician, making sure that as much oral health education and screening is happening in those types of places is really important.
Thank you.
Yeah,
Very
thank
nice.
Okay, do we have a proclamation?
Whereas oral health is essential to an individual's general health and quality of life, and whereas oral health connects to your overall health and is integral to general health, and whereas Thurston County Public Health and Social Services has prioritized oral health in the 2020 to 2024 Department Strategic Plan as a key approach needed to encourage healthy living, and whereas there are associations between oral health and diabetes, heart disease, lung disease, babies born low birth rate, and babies born prematurely. And whereas Thurston County children are having difficulty accessing dental care and are experiencing preventable oral health issues. And whereas Thurston County children and adults are experiencing preventable dental pain and tooth loss. And whereas Thurston County Public Health and Social Services Oral Health Program is working with local partners, including the Thurston Oral Health Network, local school districts, and Lewis Mason Thurston Area Agency on Aging to address oral health disparities. And whereas oral health should not be dependent on age, income, race, ethnicity, gender, or geography, and reducing oral health disparities in Thurston County will have a meaningful impact on the health of local residents. And whereas the American Dental Association celebrates National Children's Dental Health Month every February as a month-long national health observance that brings together thousands of dedicated professionals, healthcare providers, and educators to promote the benefits of good oral health to children, their caregivers, teachers, and many others. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims February as Children's Dental Health Month in Thurston County in recognition of the importance of the awareness of oral health, and urges all residents to recognize the critical importance of how oral health affects overall health. Adopted this 11th day of February 2020, signed by your Board of Health. Yay. Yeah. Getting close, getting close, getting close.
We're going to surround you.
All right, perfect. Everybody smile. Great, thank you. Thank you.
Thank you.
Congratulations.
Wonderful. Yay. Thank you, Caroline. Thank you. Thank you, thank you. Good job.
Okay, we have a second proclamation. I'm going to take off my jacket for this one. All right. This one is American Heart Health Month, and we have Chris Hawkins, Program Manager from Public Health and Social Services, and Kurt Harden from our Emergency Services Director, here to present this proclamation.
Thank you. Good afternoon, Commissioners. Glad to be back. And Chris Hawkins, I'm our Education and Prevention Section Manager at the Health Department, joined by Kurt Harden, as you mentioned. And Kurt's going to speak to some of the response to and preparations people can make to be ready in the case of a cardiac emergency, cardiovascular emergency. I'm going to speak more to the preventive side of this and maybe a little bit about the management of cardiovascular conditions. So a key to improving our community's health in Thurston County, as you'll see from the statistics and fact statements that are in the proclamation, is prevention of cardiovascular disease. And we're working as a health department on creating supports for residents to lead healthier lives and engage in healthy living, which is those health behaviors that contribute to their overall health and prevent heart disease and other cardiovascular diseases. Part of this is eating healthfully, so an eating pattern that involves higher levels of fruits and vegetables consumption. That's been associated with reduced risk for several chronic diseases, including heart disease. And then the other key part of this is getting enough physical activity, which you hear from me a lot. That is at least 30 minutes a day of moderate physical activity for adults. And then for young people, it's 60 minutes a day. And so that's crucial too for preventing heart disease and other cardiovascular diseases. Thankfully, as part of Thurston Thrives, which is our community's effort to improve our community's health, we're making it easier for local residents to engage in these healthy behaviors. So, for example, the Community Design Action Team works on putting opportunities for people to be getting that regular physical activity within easier reach of most residents. And likewise, and that's through things like our Safe Routes to School efforts and trying to create complete streets and make an inviting environment for people to be out being active, walking, biking. Likewise, the South Sound Food System Network, which is the food action team for Thurston Thrives, that strives to make healthy eating easier for local residents. For those who already are living with a cardiovascular health condition, there are ways to manage that allow them to lead a longer life and with a higher quality of life. And I wanted to just share with you quickly a program that the health department is offering as part of the Cascade Pacific Action Alliance's Medicaid Transformation Project. So we're currently offering a chronic disease self-management course, which is called Living Well Thurston in our community. It's a 6-week series of 2.5-hour sessions once a week. And that's offered throughout the year at a variety of times for people to engage in that. And they can go and find information out about Living Well Thurston by going to the health department's website and looking for the Living Well Thurston link on there, or just searching on the web for Living Well Thurston. They can also talk to their healthcare provider about chronic disease self-management and ask if they have information about Living Well Thurston, or they can talk to our own Leslie Price, who's the coordinator for our department of Living Well Thurston, and her phone number is 360-867-2515. So those are a couple things that people can do, both to prevent and manage heart disease and cardiovascular health conditions. I also wanted to mention quickly why we're wearing red today. That's to signify support for heart health, and specifically for women's health, which is often under-recognized and leads to disparities for women in heart health, making them more susceptible to various complications from that, and in other factors that impact their health. So that's why we're going red for partly for women, partly for heart health today. And now I'd like to welcome up here Kurt Harden, the Emergency Services Director for Thurston County, to talk about some of the other aspects of heart disease and cardiovascular disease.
Good afternoon, Commissioners. Kurt Harden again, Director of Emergency Services, and I want to talk a little bit about what happens if you don't eat healthy and don't get your exercise. First of all, in Thurston County and EMS, we have a tiered response system, and I want to go a little bit more into the public and the individual piece of this because we have great EMTs, we have great paramedics, but they have to have something to work with, and the intervention by citizen bystanders is critical for cardiac arrest survival. I will tell you that the latest stats we have is from 2018. We'll get to 2019 stats by May, but of the 224 cardiac arrests in 2018, 176 of those had CPR that was performed by a bystander. The reason that's critical is that's 5.7% increase in survival rate than non-bystander CPR. We can talk statistics, but I'll translate that into 7 more lives were saved by citizen CPR in 2018. That's 7 people who walked out of the hospital, back to their friends, back to their families. So what we strive in this is we want to make sure that people know what to do when it's time, or when it happens, when there's a cardiac arrest. We want them trained ahead of time. We want them to be able to know what to do. Part of that is we do CPR training at Medic One. It's compression-only CPR, free of charge, no cost to the public. But one of the biggest questions we get asked is, well, I don't know if I could do that because I don't want to hurt somebody. So I will tell you what our instructors say, and our instructors may not be as politically correct as you would like, but their answer is, somebody's having a cardiac arrest, they're already dead. All you're going to do is keep them alive until EMS arrives. So if they want to do that, it's good to know that ahead of time. Plus, 74% of cardiac arrests happen in the home. So if you want your family member to be around if they have a cardiac arrest, we urge people to get trained on CPR. And we have a graph. And that graph shows the dying process of a heart. And the biggest influence is immediate CPR that changes that dying process. Without CPR, we start losing heart muscle more and more as time goes by. And while we like to think EMS is right outside our door and 30-second response time, we know that's not true. I will tell you that in Thurston County, we have trained over 6,000 residents and people in CPR in 2019. We would like that number to increase. And by the way, that's a record number of people we've trained in CPR. TCOM, our 911 dispatch center, their dispatchers are always trained in how to give CPR instructions over the phone. But I will tell you, for someone who hasn't been trained in CPR, that's a delay to getting the CPR started. And then we want to thank the Thurston County Sheriff's Office for partnering with Medic One, because we are now deploying AEDs into each patrol car so that, because the rural areas are a little bit longer response time, if they come upon a cardiac arrest in progress, they can immediately start CPR and also have an AED on hand to help that patient survive. So I want to wrap up by saying that if something happens, we encourage people to call 911, start CPR. We encourage them to turn around and get trained in CPR ahead of time. Contact Medic One, and we can schedule you for a CPR class at no charge. And if you have any questions.
Any questions for either of our 2 presenters?
Well, just quick. Chris, did you ride your bike today?
A few times, yes, sir. Over here from the health department, yes,
Yeah,
for this meeting.
an example of being healthy.
An example.
And I'd point out that Kurt has probably scared us to death with some of his demonstrations of heart situations. So we're living it every day, and thank you for all both of you do.
Thank you all.
And you make it very meaningful. Thank you.
Chris, you mentioned the importance of diet and food to prevention, and you mentioned our action team, the South Sound, forget the acronym.
Food System Network.
Food System Network. And they have a big event coming up, am I right, in March?
Well, they've actually changed that. They are
changed that.
rescheduling the South Sound Food Summit to, I believe, the fall of this year rather than the spring of this year.
Well, that's breaking news.
I don't believe that there's a date yet determined on that. I'm looking at Leslie Price, who's our representative to that.
Okay, well, I'm
network.
glad I asked that, because I was
Yes.
planning to be there on March 14th. So if you had it on your calendar, stay tuned. We'll be resetting that. That was a good event that I attended a couple years ago, I think.
Great.
Thank you.
Thank you very much.
Ready?
Yes.
Whereas cardiovascular diseases are the nation's leading cause of death and costliest disease, with direct and indirect costs in the United States estimated to be $316.6 billion. And whereas, while progress has been significant in reducing deaths from heart disease, it is still a leading cause of death and disability for both women and men. And whereas about 801,000 people in the United States die each year from heart disease, stroke, and other cardiovascular diseases, equivalent to approximately 1 of every 3 deaths in America. And whereas 2,200 people in the United States die from cardiovascular diseases every day, and about 92.1 million American adults are living with some form of cardiovascular disease or the after effects of a stroke. And whereas an average of 585 people die from cardiovascular diseases in Thurston County each year. And whereas, as part of the American Heart Health Month, the American Heart Association launched Go Red for Women, which has become a worldwide movement to help close the gap in awareness around removing the barriers women face to achieving good health and well-being. And whereas about 80% of cardiovascular disease may be prevented through everyday healthy living steps, including physical activity, good nutrition, not smoking, maintaining a healthy weight, and controlling blood pressure, cholesterol, and blood glucose levels. And whereas the American Heart Association encourages citizens to help save lives by calling 911 if symptoms occur, getting trained in CPR, and promoting comprehensive automated external defibrillator programs in their communities. And whereas the American Heart Association is celebrating February as American Heart Month and Go Red for Women to promote education and awareness by encouraging citizens to learn the warning signs of heart attack and stroke. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims February as American Heart Health Month in Thurston County. In recognition of the importance of the ongoing fight against heart disease, and urges all citizens to recognize the critical importance of identifying symptoms, taking preventative measures to live healthy, and incorporating tools and skills that will increase survival rates and save thousands of lives each year. Adopted this 11th day of February 2020, signed by your Board of Health. Yay.
Thank you very much.
Everyone wearing red.
Thank you, Kurt. Thank you for all you do.
How many miles you got on your bike? How many
So far this year?
No, just total. I mean, you
Oh
must
my
have
gosh.
75,000.
I think it's like 8.6 billion.
A lot.
Good job, Chris.
Yeah, figure it out sometime so I can comment on it sometime.
Oh, you got everybody in? You got it? Scooch, scooch.
Oh, yeah?
I'll stand in the back. There we go. That's better. Much better. Betterer.
Smile. Perfect. Thank you.
Thank you, guys.
Thank you. Thank you. Thank you.
Hey, Stanley, don't be so worried there.
I haven't seen you in a long time. How's life treating you?
Lord, you gotta take care of us over too.
Man, feels so much better about the jacket.
Yeah. Yeah, you're right. It is.
Okay.
Did you see my red? Like my Christmas tie.
Let's get up top. Okay. That brings us, get the mic back up. All right. Number 3 is opportunity for the public to address the Board of Health. And we have nobody who would like to address the Board of Health. So we'll move to item 4, which is our health officer's report. And for that, I'm going to turn to our director, Shelley Slaughter.
Good afternoon, Commissioners. Thank you very much. I am here to give the health officers report on behalf of our 4 acting health officers. As you know, we are currently recruiting for a permanent Thurston County health officer since our former health officer, Dr. Wood, retired back in at the end of November. We have 4 acting health officers, Dr. Kathy Lofi, who also acts as our Washington State health officer, Dr. Alan Melnick, who is Clark County's health officer, Dr. Dan Stein, who is Mason County's health officer, and Dr. Masa Narita, who works for King County Tuberculosis Program. So we have been working very closely, and it's been a really busy month for our department. We've been working with our federal, state, and local health officials under the direction of our health officers in preparation for responding to the novel coronavirus 2019. So I just want to share a little bit of information with the board, as well as members of the public who may be watching and wondering what the status is with novel coronavirus 2019 here in Thurston County and in the state of Washington. I'm happy to report at this time that there are no cases in Thurston County, and there continues to be 1 confirmed case in the state of Washington, and that is in Snohomish County. As of this morning, there are 13 cases in the United States and 43,103 worldwide in 24 countries. Currently, the risk to the general public and Thurston County residents is low, and we are focused on efforts to prevent the spread of the illness here in Washington. Novel coronavirus, or 2019 nCoV, as you may have heard it referred to, is a virus strain that has only spread to people since December of 2019. Health experts and us at Public Health, Thurston County Public Health, are concerned because this is a new virus that we have not seen in humans before, and it has the potential to cause severe illness and pneumonia in some people, especially for high-risk populations that include very young children and older adults over age 65, those with comorbidities or other health conditions. Again, this is a new coronavirus, and so we have a lot to learn about it. We're learning a little bit more every day. But one thing that is important to know is that there are 7 different strains of coronavirus. 4 are very common in humans that circulate in the fall and winter. About 14% of the respiratory viruses circulating right now are those 4 common human coronaviruses, which are common cold symptoms. The other 2 that you may have heard before are SARS and MERS, which caused outbreaks with more severe illness than the common kinds that I just referred to. And now the newest one is the 2019 nCoV. Again, individuals we believe are at higher risk are those that are immunocompromised, the younger and older. The symptoms range from mild in most people to severe and include fever, cough, and difficulty breathing. Right now, we're following the CDC guidelines, which also include a recent travel history to China or close contact with a confirmed case. So if people are wondering, how can I prevent me or my family from getting coronavirus novel 2019? And that is really basic infection prevention, covering coughs with elbow or tissue, washing hands regularly with soap and water, staying away from people that are sick, and staying home when you're not feeling well. Wiping down surfaces with sanitizing solution is always a good idea. So really, that's just, we want people to just follow their common things that they do this time of year to protect themselves from illness. That's really, really the best way. There is currently no vaccine to prevent novel coronavirus infections, and testing is currently only available through the Center for Disease Control. There's a Washington State hotline for information that people may call. It operates from 6 a.m. to 10 p.m., and that number is 1-800-525-0127. There's also information available on our Thurston County Public Health website, but really it links and directs to Washington State Department of Health website, which is the key communicating agency for the state of Washington and for Thurston County. You can also visit www.cdc.gov for more information on the national response to coronavirus. And again, we are very well prepared for this event. We have a lot of amazing team members that have been working on this. The risk of the flu is much, much greater, and we highly encourage people to get vaccinated for the flu. Are there any questions that you have thus far about novel coronavirus 2019?
No, I think you've done a very good job explaining it.
Great.
I
So,
do.
yes, sir.
I heard on, I think it was NPR, they were talking about this, and correct me if I'm wrong, but MERS and SARS came from bats, and they were talking about the nCoV virus coming from bats, and bats have been around for eons and carry a ton of viruses, and they're immune to them, but they pass them on to us. Is that all true?
That is correct, sir, that this novel coronavirus strain is believed to have originated from an animal source. Whether that is bat or snake or other source has not been definitively determined yet. But yes, it is from an animal source that has been passed on to humans, and that's the first time we've seen this particular virus passed on to humans, and that began in Wuhan, China in December.
Okay, and the CDC has not declared, or the World Health Organization, whoever it does, they have not declared this a pandemic, have they?
No, not at this time.
They were talking about that in the radio too, and said, we don't even want to talk about it because we don't want to panic everybody all over the world.
No.
Okay, good, thank you.
I read, I think at lunchtime, that some health officials, CDC or otherwise, has officially renamed it to COVID-19.
Yes, the World Health Organization came out with that acronym today. So
Okay. Well,
every day there's something. Every day there's something new, and we're adapting.
I'm just
to
throwing that out there in case people hear about that. It's not.
Yeah.
It's the same thing.
It is the
What's it
same thing.
called?
And COVID-19.
So CO for corona, VI for virus, D for disease. So COVID dash 19, which I guess sounds from what you said is the origin date.
Probably the beer organization, they're lobbying against, they want something different than call it Corona, is my guess. I'm a
Could be,
conspiracy theorist.
Commissioner.
We really do want people to refer to it as novel coronavirus 19 or those other acronyms, just to distinguish it from the common coronaviruses that people sometimes have, because we don't want people to think, oh no, I have coronavirus, when in fact they have what's a relative mild respiratory common cold versus this novel coronavirus.
Is that the health officer's report then, or did you have other topics
I
under that?
I have a few more things for the health officer's report before
Perfect.
I will move on to the director's report.
Then go ahead.
So I mentioned influenza and the risk of the flu. I wanted to share a little bit more about that. Our influenza surveillance activities continue with influenza B as the predominant strain that we're seeing here in Washington State and Thurston County. We have had 3 unfortunate deaths in Thurston County this flu season, all in individuals over the age 65 with other comorbidities. Again, it is not too late to get a flu shot. We highly recommend that, as well as other recommended vaccines that are our best line of defense against preventable diseases and illnesses. Our amazing team of investigation and control staff in the last month investigated and followed up on 179 notifiable conditions, including things such as campylobacteriosis, chlamydia, gonorrhea, hepatitis A, herpes simplex, the influenza deaths, acute and chronic hepatitis B and C, herpes, Lyme disease, measles, pertussis, also known as whooping cough, salmonella, Shiga toxin producing E. coli, syphilis, and tuberculosis. So, incredible team of just 4 people that are not only responding to every meeting, every phone call that we are participating in related to coronavirus 2019, but all of the other notifiable conditions that we are monitoring every day in public health. So, great job amongst those team members. In addition to all of that, we also had a large foodborne illness outbreak last month. 50 to 60 people became ill with vomiting and diarrhea after attending a private community event in downtown Olympia. This was reported to us a couple days after the event was over, and people got better very quickly, and we believe this is a norovirus type of illness, although we weren't able to confirm that. Our environmental health staff followed up to assure the outbreak was over and worked with the sponsoring facility to clean and sanitize and prevent that from happening. And again, the best way to prevent anything like this is really hand washing, and if you're ill, stay home and don't prepare food for other people. Again, we're continuing to recruit for a permanent health officer, and that concludes the health officer's report for this month.
Any other questions?
No, sir.
I do, because you brought up the incident of the 50 to 60 people. It was foodborne illness, or was something that the preparer passed on through contact?
It was a foodborne illness, and we believe that persons that participated in the preparation of serving the food may have been ill and they didn't realize it.
And that's what spread it. They're not ill-prepared food, but food that had been contaminated.
Correct, to our knowledge. We just know that that many people, including young people, became ill after attending that event and began to report that they had symptoms.
And it was a private event?
Yes.
So the food was prepared privately, or was it a commercial food preparer?
It was a private event at a local church.
Okay, thank you.
Okay, then let's move to item 5, which is Director's Report.
Okay.
Back to Shelley.
Thank you. So again, it's been a very, very busy time for us, especially in our Environmental Health Division. You heard this morning at a briefing that we shared with you along with my colleagues, Director Hardin and Director Walker from Public Works, on our response to the recent Nisqually flooding. I just wanted to share with you again that there are currently no reported instances of illnesses or immediate public health concerns related to the Nisqually flood incident that have been reported to our department. We did issue a boil water notice over the weekend. This was precautionary, as we know that wells may be contaminated with flood water and debris, and people who reside in this area many use well water for drinking, food preparation, bathing, and cleaning. This applies only to people with wells. It does not apply to people who are on City of Lacey water. So really important that we wanted people to know that. But people who are on well water that drink that water may experience severe illness, and so we recommend that they boil water or they drink bottled water. We're really grateful to have volunteers and our wonderful donors that have provided bottled water to those residents impacted by this. And we recommend that people bring in their water for testing. Our water testing lab is right here in this building, and people may bring it here. It costs $29 to sample water, and we can get pretty quick turnaround to let people know whether their water is safe to drink. So this is a concern for us because floods can potentially increase the transmission of many different types of communicable diseases. And there's a lot of other potential health impacts that may develop after flooding, including respiratory illness due to mold exposure and hazardous materials, foodborne illness from lack of refrigeration, infection of open wounds from contaminated floodwaters, skin irritation, injuries during cleanup, lots of other risks and hazards, as well as something that I think is really important to mention, and that is behavioral health problems due to trauma, grief, loss, and distress from the event. So really important to take care of those residents there, and we're doing everything that we can to support them and working with our amazing partners, both in the community, the nonprofit community, as well as within our county offices and departments who are working closely together to assess and mitigate and reduce those health and safety impacts for those residents. We had another event this same weekend that we were busy responding to that you have heard about and people may have read in the paper. A tree fell on a large sewer pipe, releasing 30,000 gallons of raw sewage into Percival Creek. This was within the City of Olympia, and we provided support to City of Olympia to respond as quickly as possible. City of Olympia was able to repair that broken pipe, and our staff were able to go out and post warning signs to tell people to avoid contact with Percival Creek in areas that there may be access, as well as Capitol Lake and into Bud Inlet. So those warning signs remain up and in effect. So we want to urge people to avoid contact with that water. We did test the quality of the water in 4 locations today and expect to have results later this week, and we will notify the public when we believe it's safe to have contact with Percival Creek again. We also, in this last month, had another boil water notice that was actually issued by Washington State Department of Health. We received lab results on Friday, January 24th that confirmed E. coli was present in water samples taken from the Offutt Lake Resort water system. This is a Group A water system that serves the restaurant, convenience store, RV camp, and some residences. This is under the jurisdiction of Washington State Department of Health again, so we were a supporting partner with them. E. coli indicates that the water may be contaminated by animal waste or sewage, but we do not know what the source of that was. The Offutt Lake was very cooperative with the closure and the boil water notice of at their restaurant, and with subsequent testing, we're very happy to report that on February 1st, that boil water notice was rescinded by Washington State Department of Health, and the facilities were authorized to reopen. All right, I'm going to go just a little bit more here. So in other news in our department, we submitted a lead grant application in partnership with the Thurston County Prosecuting Attorney's Office, and we expect results out in March. We're very hopeful to be able to receive that grant, which would provide supportive services to those experiencing opioid disorders and other behavioral health concerns. Our opioid response program has also begun offering community-based naloxone trainings that include opioid education and the distribution of naloxone rescue kits to community-based organizations, as well as at our own department at Thurston County Public Health. Our staff have naloxone and have been trained how to deploy that. Thurston County Opioid Response Task Force held our regular meeting the 6th of January and will meet again in March. We're very happy to have such high continued interest and partners that are engaging in implementing those response activities in the plan that you approved. In our maternal child health program, we have unfortunately seen an increase in the number of child protective services cases, and we have a wait list in all 3 counties. So we also provide nurse family partnership services in Mason and Lewis County. So despite our great efforts to expand that program, this continues to be a really high need in our area, and we're really grateful to be able to provide those services. We've continued presentations with other local government partners, councils and staff, to discuss a possible vaping in public places ordinance that will be on your upcoming Board of Health agenda next month to recommend setting a public hearing. Our Office of Housing and Homeless Prevention successfully coordinated the 2020 point-in-time homeless census on January 23rd. This was a wonderful community effort. We had over 230 volunteers, including people with lived experiences. Those results are being tabulated and reduplicated, and we expect to have some preliminary numbers available in March. And next month, your Thurston County Homeless Coordinator, Kaylee Marino, will be back to share more information about that. Our cold weather shelter season is still in effect. We had one hazardous weather event that was declared from January 13th to 17th. During this time, 847 bed nights of shelter were provided with nonprofit organizations, Interfaith Works providing staffing support to increase shelter beds at Salvation Army. And we also provided shelter-in-place activities to those that could not get to shelter. Our department was also able to arrange for a 6 cubic yard dumpster to be placed at an encampment in the city of Olympia, also known as the Jungle. This is a collaborative effort as part of a regional response to manage the solid waste generated at the site and to reduce the unauthorized burning of solid waste. In response to public comment received at the last Board of Health meeting by a resident, Miss Samel, we have added an additional water sampling site on Woodard Creek downstream from the jungle. We expect to begin testing in March when the weather conditions are most conducive to doing so. It will take approximately 6 to 9 months to have reliable results on the water quality in that area, but we continue to work collaboratively with both our environmental health and our Office of Housing and Homeless Prevention, as well as our regional housing council partners and the City of Olympia to respond to potential environmental concerns in that area. In our Vital Services program, our Public Health Emergency Preparedness Team has been supporting our response to novel coronavirus 2019. Last week, we had a meeting held at Providence St. Peter Hospital that was attended by many of our health response partners, as well as both hospitals, healthcare providers, EMS, and others, to do an exercise to plan for and prepare for in the event we did have a case of novel coronavirus in Thurston County. And we've also stood up our internal incident management team within our department to provide and support and resources as we prepare for that. And that is the conclusion of my report. Do you have any questions?
That's all you got, Shelley?
Yeah,
That's all I got today.
that's it. No kidding.
Very
Questions?
good, thank you.
Thank
No,
you.
I think,
I do. Going back quite a ways to the Squally flood victims. The folks on well water that have to boil their water, the boiling alert, they can test their water, come in and pay $25 or $29 fee.
Yes.
So my couple questions regarding that. Number one, you said it was a quick turnaround. What's a relatively quick turnaround? What does that mean? And the test results.
I cannot give you an exact time frame, but generally within a couple of days.
A couple of days? Okay, that's good. And
Sometimes quicker, but
so we're not going out and testing any well water? They
No.
have to test it and come in and pay the fee and test it?
that is correct.
Why don't we test their well water? We're
That
going
is-
out to Woodard Creek and testing that water.
It's a service that we provide to general members of the public, and at this time, we haven't had any request to do anything different with our water quality testing, but we want people to know that that is available to them, and we're happy to answer any questions from any residents in
So-
that area who are
okay.
concerned or that may need assistance or have some kind of access issue.
But if they're not testing it, for whatever reasons, whether it be affordability or inconvenience, whatever, and they go about drinking the water, we're not going to go out and test the wells out there. I don't even know how many wells there are out there.
We generally don't go and do that. Generally, people provide a sample and they bring it and they can drop it off here in this building.
how would you know, sorry to piggyback, but
Yeah.
how would you know to lift the boil water notice if you're not, like you said, this boil water, how do you know
Right
to
now.
rescind that message if you're not testing?
That is just information that we are providing to the public, advising them to do so until they test it for themselves.
Just
Oh,
in
okay.
case.
It's not
Okay, just in case.
It's not a requirement. It's not
Advisement.
it's not an order by the health officer. It's a recommendation because we want to prevent potential contaminate if people have a well that has been contaminated, but we don't know that is the case at this time. We have not had any reports of anyone experiencing any illnesses or anything, which would be an indicator that that was a problem.
And I know it's a charge to the county. We have to pay for that service and such. I'm just thinking the other side of it. For a flood victim,
Yes.
it'd be nice. Okay.
We're trying to do everything that we can to work together to find solutions to support people.
Otherwise, it'd be a gift of public funds or something. Wouldn't it?
That's right.
Got it. Okay. Stupid laws. Okay. Thank you.
Okay, thank you, Shelley.
Thank you.
And that brings us to department items, number 6. And we have only one item, but it's an important one, Thurston County Family Assistance Center. Erica Catt. Stanley Phillips.
Yay.
This will supplement.
Thank you, sir.
Thank Thank you.
Thank you, Board of Health, for having us speak today. My name is Stanley Phillips. I'm a senior victim advocate with the Thurston County Prosecutor's Office in their Crime Victims Advocacy Network program. And Erica, Kat, and I are going to be presenting today on the Family Assistance Center plan, the collaborative plan that we've been working on with many, many community partners. Erica will talk more about that. I'm going to talk more specifically about the Tumwater incident that happened back in June of 2018. Back on June 17th of 2018, there was a mass shooting incident that happened in the city of Tumwater in and around the Walmart area. It was an individual that drove from McCleary and shot up multiple scenes. We have eight identified primary victims that were either shot or shot at, and 88 identified secondary victims. That happened on a Sunday evening. Monday morning, the next Monday when I came to work, I contacted Commander Mason at the Tumwater Police Department on behalf of the prosecutor's office and offered our services from our victim advocate unit. Responded over there, met with him and Detective Kolb, who was the lead detective, got an update on what was going on, how many victims we had, and then we formulated a plan based on that need to contact every one of those primary victims, do a needs assessment, offer services, see where people were at. And the other thing that came out of that conversation, because this happened in a very large public area with 8 different crime scenes, is that we knew that there was going to be many secondary victims that we did not know about, witnesses to the crime, Walmart employees, and other people that might need assistance. And so with that, the idea was developed to have what we would now call a family assistance center. We called it a victim resource fair. We wanted to have it as soon as possible because we figured we had a lot of people in acute trauma. I had been sent to a mass violence training the year before that down in Oregon, so that was very helpful. So we set that up for Wednesday from 10 to 2 in the Tumwater City Council chambers, put out a press release. I got busy contacting all of the victims, inviting them to that, and then Tumwater Police and the Crime Victims Advocacy Network Prosecutor's Office site put out the other press release. So between the invitations and word of mouth and letting the folks at Walmart know, we did have quite a good turnout for the event. We had about 55 people there. It started at 10. They were already lined out the door at 9:30. There was definitely an identified need for these. We'd never done one before. To our knowledge, this was the first one that was set up after a crime-based incident in Thurston County. And I listed here all the different agencies that we contacted. We would not have been able to do this without the partners. I mean, clearly, the behavioral health organization really stepped up. We did a conference call with them. They said they would contact all their contract providers and ask them to be there for mental health. That was a key component of this. We also had the Washington State Crime Victim Compensation Program on staff. They were able to help people immediately fill out applications for mental health or medical treatment, time loss, wage reimbursement, pharmaceuticals, things of that nature that would be covered. Marshall the courthouse dog was there. The Family Support Center came and provided activities for children and also family services. And we also contacted Walmart to find out if they'd be willing to donate food for the event. They stepped up and more than happy to donate children's activities, food, water, all the type of hospitality items so that victims were comfortable when they came there and their families. So on Tuesday, I went to Walmart, did a big donated shopping trip. We identified the layout of how this Family Assistance Center would look, where the tables would go. We did have some private meetings at the Tumwater City Hall that were really helpful because we had people that were coming in that were in acute crisis, having breakdowns, and really needed to meet with a designated crisis responder, and we had private areas for those families to meet with. So anyway, then Wednesday we did have the fair. The fair starts. Towards the end of the fair, well, let me go back. The fair, the Tumwater Fire Chief showed up, turned out to be a great resource because he was able to answer a lot of questions that people had about medical issues, the fire department response. Tumwater Police were there. That was very helpful because a lot of items, vehicles and such were impounded as evidence, and people were not able to access those and had items that they needed to get out of there. And then towards the end of the resource fair, I was contacted by the Sheriff's Department, their SWAT negotiators, wanting to know if they could come to the resource fair. They heard about it. They were doing training that day, and they wanted to interact with all the mental health providers there and get that information. So that kind of turned out to be a win-win. During the fair, it went very smoothly. We had a team of victim advocates, both from our office and other community organizations that acted as navigators. So when people initially came in, we were able to let them know what the layout looked like, what services were available on site, that everything was free and confidential. And then we had an area similar to this where families could sit. And we didn't really know what exactly to expect, how this was going to play out, but how it played out was very smooth. People took their turns. Some people parked in front of mental health providers and really just took advantage of that free service. We had another full room from the Crime Victim Compensation Program that were filling out applications. And then instead of people leaving, they stayed. Oh, most of them stayed. They wanted to talk with the other survivors. There was a camaraderie that was really built with them. Marshall, the courthouse dog, was a wonderful asset. He provided a great service. And through that, the people were trading phone numbers. They were on their Facebook pages. And so this group really developed an amazing support for each other, which we find, through the evidence that is very common after a big incident like this. And in fact, a year after this happened, we all got together. Walmart once again donated. Our office teamed with the Tumwater Police Department. We went out to Kennydale Lodge and had a day of reflection, had food, had mental health provider on site, did a session on post-traumatic growth, had workshops, had lunch. It was just a wonderful event. And it was done right around the anniversary of the shooting. And the idea behind that was so that these folks that were affected would not have this negative situation to look forward to. They actually had something positive to look forward to in that camaraderie. So the agencies that participated, on the next slide here somewhere. Oh, hold on. This thing goes faster than I do. Those were the partnering agencies that came. I'll let you read through that. But what I will tell you is all the work that we've been doing, over the past year and a half or 2 years since we've had this really, really demonstrates the need for partnerships. And that's what I want to really highlight that we have been working on in the community is the partnerships with the health department, with emergency management, with the prosecutor's office, with the local fire department, schools. And those partnerships are going to build as we continue this plan. So we did have a lot of needs that were identified, in-person and telephone crisis intervention, more mental health and trauma counseling, case management long-term. Now from this incident, we did have the State Office of Crime Victim Advocacy that's one of our main funders for our Victim Advocate program. They were there on site. They do have a program manager that works mass violence programs. And she saw what was going on and said, whatever you guys need, let me know and we'll try to say yes. And so we put together a grant at the prosecutor's office, submitted it, and they awarded us $45,000 for a half-time employee to help these victims and survivors throughout the next year. And then also there was a large portion of that funded emergency assistance because out of this came vehicles that needed repaired. The suspect was shot in one of the victim's vehicles and there was biohazard things inside that needed to be cleaned up. Other victims had bullet holes in their vehicle. They were impounded. Some people didn't get mental health counseling right away. Some people's vehicles that were taken away as evidence did not live on a bus route and didn't have transportation. They couldn't go to work. They needed food. So there was a real, it was very obvious that there was an emergency assistance need that we needed to meet. We even, that grant even paid to replace one of the victim's showers because he's in a wheelchair now and still it remains in that wheelchair from this incident. So, and then we had a debrief meeting about a month after with all the professionals that came because we wanted to hear feedback. What did we do right? What went really well? What could we do better next time? And that's how we got this debrief feedback. And I'm not going to go over all of it with you. You have it in front of you. But I'm happy to answer any questions that you have.
Commissioners?
Mr. Phillips, I guess I'd like to commend you and your organization for all the work that you did with those individuals that were adversely affected by this situation. But I do want to mention that an armed citizen was able to intervene in this situation and actually shot and killed the perpetrator on this deal. And it could have been very much worse than it was. And I'm glad you folks got the training, and I hope we never need to utilize it again. But thank you for everything that you did and your group.
Appreciate it.
I ditto that, of course, as well as when you talked about the critical need to have partnerships. I'm looking at the list of agencies participating. There are 17 that you've listed. That's considerable. And I just encourage, no matter who it is or whom it is at home even watching, if you're involved in anything, that for even the flood example, the flooding and such, set up those partnerships now, those relationships now, so you have the contacts. Do it in advance. Don't wait till the last minute and try to, who do I contact and do I trust you, with your angle. Set those partnerships and relationships up in advance. It just makes it a lot smoother.
Yeah, you're exactly right, and that's what we're doing, and a lot of it's the relationship building and the trust building and knowing what organizations can and cannot do.
Yeah.
And so we're doing tabletop exercises. We're continuing to do those. We're continuing to bolster the plan, also to get a call-out list done so that we have up-to-date numbers that we're going to be vetting and checking. So we're very committed to this and committing to serving the citizens of Thurston County.
That's comforting.
So
Thank you, sir.
Thank you, Mr. Phillips.
Thank you, I appreciate it.
Erica, come on forward. Adjust the mic as needed. Thank you.
Okay. My name's Erica Catt, and I am an emergency preparedness and response coordinator with Thurston County Public Health. And I have been working closely with Stanley and Thurston County Emergency Management in creating this plan. It's called the Family Assistance Center Plan. And many partnering agencies in the county have been participating in this planning process, as we'll get into. So our first meeting was held October 23rd of 2018. It kind of stemmed from the Walmart shooting and so many other, the Amtrak derailment, and all of the other mass casualty, mass fatality incidents that were happening around the world. There's, 1 October with the Las Vegas shooting. There's countless others. And planning for some type of incident that could happen in Thurston County it happened. It happened at Walmart. It could have been way worse. So we took steps over the last year to meet with several of our planning partners, which I'll go over those partners here in a minute. Two of the key partners that we've met with were Thurston Mason Behavioral Health Organization and the Thurston County Coroner's Office. They're two very essential partners in Family Assistance Center planning when it comes to mass casualty, mass fatality incidents, and they are both reviewed the plan, 100% behind the plan, and ready to activate if necessary, hopefully not. As we've moved over, having several meetings working out the details of the plan, we did a tabletop exercise in June of 2019, and during that time we really went through that plan in a fine-tooth comb, just kind of asking questions and seeing could it really work. We found some areas of improvement, and over the last several months we've made those corrections, and we will continue to make those corrections as we move forward. So now I'm going to kind of get into the nitty-gritty of the plan itself. So the purpose of the plan, on what's up on the slides, they're exactly from the plan itself. So the purpose of the Family Assistance Center plan is to guide Thurston County and family assistance response related to the consequences of mass fatality or mass casualty incidents resulting from natural or man-made disasters. These incidents may include all hazard or intentional violent criminal acts that result in physical, emotional, or psychological harm to a significantly large number of people. The scope is the Thurston County Family Assistance Center plan is applicable for all incidents which require coordination and centralization of information for families and friends, accessing incident information, and locating family members. So the plan itself comes in two different pieces. There's a reunification and notification center, and there's a family assistance center. Both of these, they're both services, or they're both centers that provide different resources or the same resources. But one has a specific job of the reunification notification center is established during or directly following an incident. to provide a safe and secure facility away from the incident site. You don't want the people still at the scene. You want to get them away. For families to gather an information or notification, or to be reunited with their family members. Some of the service that could be provided in the Reunification Notification Center is security, behavioral health, spiritual care, reunification, medical and first aid, translation, interpretation services, and childcare. Childcare may seem odd, but many times families are involved, and sometimes parents don't want to bring their kids or have their kids involved in that. It also may include children. So putting that piece into the plan was, and we've looked at many plans throughout the nation, and childcare was a key component to have in a plan. Both the Reunification and Notification Center and the Family Assistance Center, they can be virtual or physical locations. They could be separate from one another. These two centers, they can be separate from one another. They can be together. Or you could just have a Reunification and Notification Center or just a Family Assistance Center, like in the Walmart shooting. There was just a Family Assistance Center. So we'll get into what the Family Assistance Center is. Like kind of Stan was saying, the Family Assistance Center that's essentially was what the Walmart shooting, the Victim Resource Fair was. And it's a safe, secure physical or virtual facility for family members and those affected to receive necessary resources for recovery. The duration and the resources provided at the Family Assistance Center or the Reunification Notification Center may depend on what the incident is. It's flexible, it's breathable, it can be very quick, or it can go for a longer duration. Some of the resources that could be at the Family Assistance Center is animal care, banking, crime victim advocacy, disability information, legal assistant, Veterans Affairs, and worker compensation. The list of resources is a mile long, but those are just a few of them that we mentioned. One example of a Family Assistance Center that's virtual that is still going on is the 1 October shooting in Vegas. That is virtual and is still ongoing for those victims. So that is a Family Assistance Center that is flexible, that is going for a longer period of time to meet the needs of the people involved. So during this planning process, we had a ton of community partners that were involved in the creation of this plan. They're committed to help implement the plan and practice the plan in real life or full-scale scenarios such as a mass casualty incident or practice that fire departments often have. There's tabletop exercises and functional exercises that can be done, and everyone is excited about it. So these are the list of partners that have been involved. Just to name a few: the Prosecuting Attorney's Office, Crime Victim Advocacy Network, Public Health and Social Services, Emergency Management. Those are the key coordinating agencies for this, along with local jurisdictions. And if this did happen, it would involve incident commanders or unified command, those people on scene. So some of the next steps, we continue to plan with community partners for that duration. We'll continue exercising the plan, making changes as necessary, any gaps that we find, and continue working on the resource manual call-it list that Stan mentioned. It's provide a guidance tool to the coordinating agencies on who to call if a Family Assistance Center or Reunification Center is needed, and meet with response agencies that may utilize this resource, places like school districts, first responders, and so forth. So that is pretty much it in a nutshell. Is there any questions?
Commissioner Edwards.
No, I'd just comment that I think what you're doing on a regular basis, preparing, is very much like the rest of us have insurance on our car. We don't have it because we're planning on getting in a wreck, and we hope we never do. And I hope you don't have to use that. But thank you for you and your organization, Erica, for making this at least available should some bad situation develop.
It's one of those things you hope you never have to use, but it's exciting and dynamic to learn this stuff, and you want to, you know what I mean? You want to see if it comes together, but you don't want to, because there's that dynamic, but brilliant, just brilliant. I'm glad you're doing this, Erica. Thank you.
You're welcome.
Thank you, Erica.
Awesome. Thank
Yep.
you, guys.
Okay, great. Brings us to item 7, Board of Health members' health-related activities. Start with Commissioner Edwards if he has anything to report.
Well, health-related. I went to a after-hours evening event out at the Evergreen College, trying to get some support there on excessive nitrogen in the river. Very good reception, I might add. We've had follow-up calls back since that presentation earlier in the week. The flood issue, obviously, I think we were all involved in that. Several visits down there to see that everything is going right. Several homeless issues. And I just wanted, one thing I wanted to add or ask Shelley. Walmart delivered a lot of water to us. Was that what was going on?
Yes, for the Nisqually flood response, Walmart donated, and I believe Costco as well, donated bottled water that was distributed by volunteers to victims of the recent flooding.
Of water, yeah.
Yes.
Yeah, I just want to point out to those organizations that it's what a help it is when groups come together to help everybody out. I will say on the Nisqually River Council is pushing ecology on new biosolids regulatory process. And I will say I'm not too thrilled with ecology's response that this biosolids, oh, it's not so bad. Well, I think it's pretty bad when it comes to our clean water and our environment and protecting our environment. So if anybody would like to know more about that, there's a very good article in the Nisqually Valley News last week if you're interested in biosolids. Detrimental to all of our health. That's it.
Vice Chair.
I'd just like to say, for the first time in quite some time, my wife's and my health, our adult children and their spouses, and the grandbabies are all healthy currently, to include our puppy, who's already up on all of his shots. Yay.
Good job, sir.
Okay, I had, of course, I sit on the Thurston Thrives Coordinating Council, and we had a meeting, and I also attended a meeting at WASAC related to challenges facing the behavioral health system and the integration that's in the process of occurring, and how there were county commissioners from all over the state, and we were brainstorming about how we might work together to present a consistent message to the legislature about what's not working for us with behavioral health. And as I mentioned at the last meeting, the Innovative Justice meeting this morning, last month's meeting, we were talking about sort of almost like strategic planning, like what was going to be on our work plan for 2020, something bigger. And that conversation continued today. And I always have to leave about 10 minutes early to get to agenda setting, but the way the conversation was evolving was really to look at the gaps in the mental health system as they relate to the criminal justice system. Think about a big idea that would really help the system close those gaps, and then go to the, and then formulate a vision that we could take to the legislature, rather than, of course, we'll also be working on parallel track, but what it seemed like is we have this inadequate resources, inadequate system, and I think of it as like a bunch of hoses flying around, and none of them are big enough. They're all small, and we're trying to grab them and twist them to where we need them to go and patch them together. And that's one way to do things and what we kind of have to do, because that's the system we have. But I wanted on a parallel track, and I think the group wanted on a parallel track to think about a big straight hose that just did things efficiently and completely, and push for that and try to articulate what that would mean, whether it's resources for a facility. What we were really talking about was a facility that would be it wouldn't be a jail and it wouldn't be a hospital. It would be something in between, co-managed by law enforcement elements and medical and professional treatment elements. That would really be something that would kind of close a lot of gaps. So anyway, I found that discussion very exciting, and that was what the group worked on, and that's it for my health-related report. So, without further ado, I guess we are done. And as a lawyer that always wanted to be a judge, I'm going to bang the gavel and adjourn.
Well done.
Very good.